Hello, I'm Dr. Elaine Leventhal, a retired professor previously in the Department of Medicine at Robert Wood Johnson Medical School. I have over 30 years of clinical experience working with geriatric patients. Older patients are often affected by persistent pain, which can be associated with musculoskeletal disorders such as osteoarthritis or OA. Prescription treatments are not always necessary to manage OA and other common pain conditions that are associated with aging. Over-the-counter analgesics may provide sufficient pain relief, which might contribute to improved function and quality of life for our patients. However, elderly patients with pain must be evaluated carefully because they tend to have more coexisting medical conditions than younger patients. These conditions can impact our choice of an appropriate analgesic recommendation. As individuals age, their pathophysiological profile can change. Organ function may decline, particularly in the hepatic and renal systems. Patients with renal insufficiency may be at increased risk for acute renal failure if they use NSAIDs regularly. Hepatic function may also decline with age. Although hepatocytes have remarkable rejuvenative capacity, damage from toxins can accumulate over time. This damage can lead to an increase in hepatic risk, which is an important consideration when recommending acetaminophen. Our geriatric patients may also have increased risk of cardiovascular events, including myocardial infarction and stroke. Cardiovascular risks may be exacerbated by the use of non-aspirin NSAIDs. Geriatric patients are more likely to experience gastrointestinal toxicity than their younger patients. When these events occur, they can be more severe than those in younger patients. We must consider these factors when recommending NSAIDs, which may also increase gastrointestinal bleeding risk. Most of us understand that geriatric patients are more likely to be taking multiple medications compared with their younger counterparts. Use of multiple medications increases the potential for drug-to-drug interactions. We must carefully consider each of our patients' medications, even when making an over-the-counter analgesic recommendation. Patients taking multiple NSAIDs are at increased risk for gastrointestinal bleeding and renal dysfunction. Additionally, use of steroids increases the risk of upper gastrointestinal complications in older patients, and this risk increases significantly when a steroid is taken with an NSAID. Elderly patients are often prescribed anticoagulants. NSAIDs can increase the risk of bleeding when taken concomitantly with anticoagulants. The benefits of low-dose aspirin heart therapy may be attenuated if patients are also taking ibuprofen. Ibuprofen and aspirin both bind to the platelet COX-1 receptor. When ibuprofen is bound, aspirin is not able to access the receptor. That's potentially compromising the cardioprotective benefits of aspirin. While we understand the importance of all these considerations, patients may not. As a result, they may fail to mention all of their medications to us. One approach to solve this problem is known as the paper bag technique. Ask patients to bring a bag containing all of the products they are using, including supplements, over-the-counter, and prescription medications, and homeopathic preparations. Use of the paper bag technique allows us to review all of these products with the patient and discuss how they may impact our analgesic recommendation. Determining patient expectations for an analgesic is also critical in helping patients avoid harmful effects. We need to know what the patient thinks is the source of the pain and discuss the treatability of the pain symptoms. Then we can educate the patient about what to do to feel better. Patients need to have reasonable expectations regarding pain relief. We should discuss how much relief is possible, how soon it can be achieved, and what needs to be done to achieve the maximum level of relief. Non-pharmacological modalities can be an effective component of a treatment plan. To treat short-term acute pain, over-the-counter analgesics may be beneficial. This conversation provides an opportunity to speak with your patients about safe use of over-the-counter analgesics. Patients need to know the maximum daily dose of their over-the-counter analgesic. We can help ensure that our patients understand how to read their medication labels to identify ingredients in all forms. When we talk to geriatric patients, we must ensure they understand what we are telling them, but avoid being condescending or insulting. Avoid language that might be perceived as patronizing. Visual aids, such as pictures and diagrams, can be used to help clarify and reinforce key points. Medication-related side effects and complications are more frequent in the geriatric population. We must always remember to consider a patient's coexisting medical conditions, current medications, and age when making a recommendation for an over-the-counter analgesic. We need to know what patients expect from treatment. Only then can we guide them.